Menopausal issues. As you grow old, you are going to attain menopause at some point or the other. Usually 40s, late 40s, early 50s. And what do you go through when you attain menopause? So, physically speaking, your periods are going to slowly stop. They might come early for some time. For some people, it becomes delayed. For some people, they have heavy bleeding. Some people have less bleeding. So this disturbance continues for some time till it slowly stops. It'll start coming once in 2 months, once in 3 months, once in 4 months, and then gradually once in 6 months, once in a year. It's different from person to person. I've seen that this also depends upon how the mother had menopause. If she's had it in her early 40s, late 40s, early 50s, a similar pattern is seen in ladies who undergo menopause. This is only the physical part of it. That is not what bothers them. They're okay. You can deal with these things. You can go to a doctor, take some medication and take care of it. But what is difficult to deal with in menopause is the emotional thing that it causes. A lot of women, they become moody, they become cranky, they want to cry, they become angry, they want to shout. They're not themselves. This also happens much before the menopause. Even when you're young, during the period, just before the period, you realize that you're not yourself. You realize you're very sensitive, you're very moody, you're very cranky, you're shouting at people, you lose your patience on everything. Then you get your periods and then you're a different woman altogether. Everybody in the house knows when you're around your periods. That is how horrible you are as a person. And then suddenly you are all yourself. The loving, understanding, compassionate woman you are. This is not your problem. These are being done because of your hormonal changes that is happening in you. A lot of people are not aware of this. They eventually end up with a psychiatrist. The psychiatrist put them on a whole lot of medication. They are drugged and it causes more problem. They become addicted to the medication. You end up as a psychiatric patient, not knowing that this is not your problem, not knowing that it is your hormones which are causing all these things in you. Your parents, your family, your parents, your children, nobody realizes that it is not you. It is the hormones that is causing a problem. Then a lot of women during their menopause come up with hot flushes. They suddenly sit and they are profusely sweating. They are sleeping in the AC room but they profusely sweat. Then they suddenly get this bad palpitation, ghabrahat. They feel anxious. They feel fearful. They don't know what is happening. These are all basically the symptoms of menopause. These are all what menopause can do for you. These are all happening because of your hormonal issues. Well, you go to the doctor. The gynec says, get rid of your uterus. Anyway, you are done with it. Take some hormones for some time. Getting rid of the uterus is a big issue for a lot of people. You've heard of a lot of people post, my uterus was removed. I put on weight. I'm having backache. I'm having this one. I'm having that one. You start on hormones, you'll again have side effects of hormones. As it is, you're bothered because of your hormonal issue. And then additionally, you get side effects of it. What is your solution? Homeopathy has a solution to these menopausal issues. We've been able to help a lot of people. Once you start on the medication, the physical issues, number one, the bleeding can be taken care of. If you're excess bleeding, there are medicines which can take care of it. If you're not having heavy bleeding, if you're having scanty bleeding, if you're having if you're having delayed bleeding, we don't take care of it. That's okay. That's a natural process. You need to understand that whatever is happening in your body during menopause is a natural process. The body is trying to stop your periods. It's not going to just happen like that. It will happen slowly. You need to let the nature take care of it. You can't interfere. Every time you have heavy bleeding, take a hormone and stop it. You are not bleeding every month, okay, take something, cause bleeding. What are you doing here? You're interfering with the natural process. When you don't let it happen naturally, you end up having a lot of other issues which people are not realizing. The 70% of the rural women who are ignorant and who don't have the money to go to gynecologist, they are the safest people. They don't interfere. They become alright. They don't have these typical mood swings and all that like you guys have. They're very happy. Natural things that happen in the body because of aging should be left alone. Having said that, I am not saying my medicines are going to interfere with it. No. Homeopathy is a very natural way of treating these kind of things. We can help you control the excess bleeding if you have any. We can definitely take care of those hot flushes, that sweatings and stuff like that. Emotionally, homeopathy is able to do a lot for people going through menopause. We are able to help them control their mood swings. People have come and told me within few weeks of starting it how better they have become. Every month their mood swings get better and better and better to a point where it is bearable. We've had a lot of success stories treating menopausal women. What to do during menopause? Keeping yourself busy, exercising, keeping yourself fit, because menopause is a time you'll put on a lot of weight. So keep yourself fit. Follow the diet that I suggest on my website, Dr. Manoj's diet plan. Please go through it. If you're able to make sense. A lot of women during menopause, one of the biggest issues is putting on weight. Whatever you do, you will not lose weight. A lot of women following this particular diet and with medications have been able to lose weight. There is a saying that during menopause you can't lose weight, but with this diet and some medications you can lose weight. Try it out. These are very safe. Keep yourself joyful. Try and do meditation, breathing exercises. Try to be outdoors. Try to avoid too much of stress. I always tell people who come to me in their late 40s and 50s, as a woman, you spend all your life taking care of others from childhood. Then you get married, you take care of your husband, you take care of your in-laws, then children, then grandchildren. When is the time that you have for yourself? This is the time. Menopause is the time when you need to focus on your health, your mental and physical health. Make yourself priority. You've done this for so long. Now you take care of yourself. Give yourself that happiness. Give yourself that freedom. Give yourself some time. Find happiness. This is the time. You take care of yourself, and with my medicines, I will take care of you during your menopause. I will help you have an easier menopause than you would normally have. Take care.